Hey guys, welcome to Quickfire Medicine, your place for fast, high-yield content for medical students and junior doctors. Today's topic is on causes of acute pancreatitis. The best way of remembering causes of acute pancreatitis is the much-quoted mnemonic, get smashed. The first two letters, G for gallstones and E for ethanol, are by far the most common causes, together making up to 80 to 90% of cases, and they're really the main ones to focus on when the diagnosis is made. Gallstone pancreatitis occurs when gallstones, either migrating to the distal common bile duct, or CBD for short, or main pancreatic duct itself, causes obstruction of biliary flow, which increases duct pressure, triggering an inflammatory response in the pancreas. Although CT abdomen is the most often used imaging to diagnose pancreatitis, through fat stranding or complications like necrosis or pseudocysts, is relatively poor at identifying gallstones. Therefore, ultrasound abdomen is the best imaging to identify gallstones obstructing the CBD or pancreatic duct that might need endoscopic removal with an ERCP, and so is done in almost all cases of acute pancreatitis, even after a CT scan. Ethanol, i.e. alcohol, is the other major cause of acute pancreatitis, where the direct toxic effects of alcohol's metabolites causes pancreatic inflammation. It is classically the acute alcohol binge that causes acute pancreatitis, but repeat acute attacks and chronic alcoholism can lead to chronic pancreatitis, which I'll cover separately. Now moving on to the rarer causes of acute pancreatitis. T is for trauma, and you should consider traumatic pancreatitis with anyone who's at risk of having some form of abdominal trauma, including in motor vehicle accidents or direct strike to the abdomen, so don't forget to add on a lipase or amylase to the bloods of your trauma patient. S is for steroids, so check the medication history for this. Steroid-induced pancreatitis can occur even after short-term high-dose steroids and tends to occur within 2 weeks of initial exposure. M is for mumps, as well as other viruses like EBV, CMV, and HIV. Mumps virus usually causes a fever and parotitis, but can lead to inflammation of most organ systems like meningoencephalitis and epididymolysis, as well as pancreatitis. A is for autoimmune disease and Ascaris infection. Autoimmune conditions like SLE and polyarteritis nodosa can cause pancreatitis. A specific condition, autoimmune pancreatitis or AIP, is becoming increasingly common, particularly type 1 AIP, which more often presents similar to pancreatic cancer as painless jaundice and is related to raised IgG4 levels. Ascaris is a parasitic infection that invades the biliary and pancreatic ducts to cause pancreatitis, being much more common in certain parts of India. The second S is the much-remembered scorpion bite, although you'll do well to see a case of this. H is for the two blood test hypers, hypercalcemia and hypertriglyceridemia, as well as the two vital sign hypos, hypothermia and hypotension by way of ischemia to the pancreas. Hypertriglyceridemia is becoming an important but easily missed cause, being the next most common cause after gallstones and alcohol, and usually only develops with markedly elevated serum triglyceride levels above 1,000 mg per deciliter. E is for ERCP, which is a procedure I've already mentioned as one of the treatments of gallstone pancreatitis to remove obstructing gallstones from the CBD or pancreatic duct. It can actually itself cause pancreatitis, holding a 5 to 10% risk due to instrumentation of the ducts causing obstruction or pressure injury from contrast injection. Finally, D is for drugs. Apart from steroids, there are many other drugs that can cause pancreatitis. I use the mnemonic SAT-NAV to remember the rest, but it's best just to look up the drug in question. So that's what you need to know about the causes of acute pancreatitis. If you enjoyed this video, don't forget to hit that like button, comment down below, and subscribe to my channel. Thanks so much for watching, and see you next time.